perform and some of the tips for performing a barbell squat exercise in order to do it correctly. The barbell squat is, without a doubt, in my mind, the single best lower body exercise that you can do. However, it does have a history or kind of a reputation with putting some strain on people's knees, their hips, and in particular the lower back. So I want to avoid any pitfalls or problems that you might have with performing this very beneficial exercise, certainly with regard to your lower back. As you perform a squat, what happens is the more powerful hip or gluteal muscles, as they're being stretched when you squat down, tend to pull the pelvis into what we call a posterior pelvic tilt. That is, they rotate the pelvic bones backwards. That's not normally a problem, except that it induces lumbar flexion. In other words, it takes away or it reduces the inward arch in the lower back, the lumbar lordosis, which is what we want to maintain. So as you can see, as I come downward, the inward arch or lordosis in my lower back is reduced. We don't want to do that. It's a natural tendency of the biomechanics of the musculature around your hips, but we want to try to fight that. So as I come down, I'm going to actively try to induce as much lumbar lordosis or inward arch in my lower back, trying to keep my pelvis rotated anteriorly, or what we call an anterior pelvic tilt. Trying as much as possible to keep that inward arch in my lower back. That gets more and more difficult, I think quite obviously, as you become more fatigued and as you go deeper with your squat. I want to demonstrate it here with a standard barbell, and this is a real set for me. In other words, I'm really going to be exerting myself. I'm going to try to perform 50 repetitions, 50, and as I get more fatigued, in order to make this realistic, you're going to see that maintaining that inward arch in my lower back, which is very important so that you don't injure your lower back, maintaining that inward arch or anterior pelvic tilt is going to become more and more difficult. So you have to really think about it and really try to keep that inward arch in your lower back to the maximum degree that you can possibly maintain it. I have a standard Olympic bar here. It weighs 45 pounds, 1.25" bar with 2-inch ends to put the plates on. I'm not going to use any plates. I'm just going to use the bar, and again, I'm going to try to get 50 repetitions. Again, just briefly repeating, you want to maintain the inward arch in your lower back as much as you can possibly do so during this exercise. So here I go. Let's see if I can get 50. I'll arbitrarily pick 50 because I know that will be more than enough to fatigue me. Eight, good. Coming up on number 10 here. There's 9 and 10. Starting to feel some fatigue. Really trying to keep my lower back arched inward. That lumbar lordosis. The inward arch in the lower back. What we physical therapists call the lumbar lordosis is vital that it be maintained during this exercise. You can probably keep better track of the repetitions than I can. I'm coming up on what I think is 20. There's 30. I have to really think about it to keep that arch in my lower back or the lumbar lordosis. I have to really work to keep it. Should be right around 40. Really getting fatigued. I think that's 50. I'm going to keep going. Boy, very good. Again, I'm going to try to talk. The most important thing with doing the squat, keeping good form, doing them relatively slowly, and again, maintaining an anterior pelvic tilt, inward arch, lumbar lordosis, as you do them smooth and clean. One of the single best, if not the single best, lower body exercise you will ever do.